NMCCBT questions and answers. Option number 276. You have assigned a new student to an experienced healthcare assistant to gain some knowledge in delivering patient care. The student nurse tells you that the HCA has pushed the client back to the chair when she was trying to stand up. What is your action? Option A: as soon as possible after an event has happened, to provide current, up-to-date information about the care and condition of the patient or client. Option B: every hour. Option C: when there are significant changes to the patient's condition. Option D: at the end of the shift. The correct answer is option A: as soon as possible after an event has happened, to provide current, up-to-date information about the care and condition of the patient or client. Question number 277. A patient with learning disability is accompanied by a voluntary independent mental capacity advocate. What is his role? Option A: express patient's needs and wishes. Acts as a patient's representative in expressing their concerns as if they were his own. Option B: just to accompany the patient. Option C: to take decisions on patient's behalf and provide their own judgments as this benefit the client. Option D is expert and representatives client's concerns, wishes and views as they cannot express by themselves. The correct answer is option D is expert and representatives client's concerns, wishes and views as they cannot express by themselves. Question number 278. When do we need to document? Option A: as soon as possible after an event has happened, to provide current up-to-date information about the care and condition of the patient or client. Option B: every hour. Option C: when there are significant changes to the patient's condition. Option D: at the end of the shift. The correct answer is option A: as soon as possible after an event has happened, to provide current up-to-date information about the care and condition of the patient or client. Question number 279. After finding the patient, which statement would be most appropriate for the nurse to document on a DATIX incident form? Option A: the patient climbed over the side rails and fell out of bed. Option B: the use of restraints would have prevented the fall. Option C: upon entering the room, the patient was found lying on the floor. Option D: the use of a sedative would have helped keep the patient in bed. The correct answer is option C: upon entering the room, the patient was found lying on the floor. Question number 280. Adequate record keeping for a medical device should provide evidence of. Option A: a unique identifier for the device, where appropriate. Option B: a full history, including date of purchase and where appropriate when it was put into use, deployed or installed. Option C: any specific legal requirements and whether these have been met. Option D: proper installation and where it was deployed. Option E: schedule and details of maintenance and repairs. Option F: the end of life date, if specified. Option G: all of the above. The correct answer is option G: all of the above. Question number 281. Barbara, a frail lady who lives alone with her cat, was brought in A&E via ambulance after a neighbor found her lying in front of her house. No doctor is available to see her immediately. Barbara told you she is worried about her cat who is alone in the house. How will you best reply to her? Option A: you should worry about yourself and not the cat. Option B: your cat sounded like very dear to you. Can I ask your neighbor to check? Option C: do you want me to see your cat also? I cannot do that now. Option D: your cat can look after itself, I am sure. The correct answer is option B: your cat sounded like very dear to you. Can I ask your neighbor to check? Question number 282. The nursing staff communicates that the new manager has a focus on the bottom line, and little concern for the quality of care. What is likely true of this nurse manager? Option A. The manager is unwilling to listen to staff concerns unless they have an impact on costs. Option B. The manager understands the organization's values and how they mesh with the manager's values. Option C. The manager is communicating the importance of a caring environment. Option D. The manager is looking at the total care picture. The correct answer is option A. The manager is unwilling to listen to staff concerns unless they have an impact on costs. Question number 283. The nurse suspects that a client is withholding health-related information out of fear of discovery and possible legal problems. The nurse formulates nursing diagnosis for the client carefully, being concerned about a diagnostic error resulting from which of the following? Option A. Incomplete data. Option B. Generalize from experience. Option C. Identifying with the client. Option D. Lack of clinical experience. The correct answer is option A. Incomplete data. Question number 284. A famous actress has had plastic surgery. The media contacts the nurse on the unit and asks for information about the surgery. The nurse knows. Option A. Any information released will bring publicity to the hospital. Option B. Nurse are obligated to respect client's privacy and confidentiality. Option C. It does not matter what is disclosed, the media will find out anyway. Option D. According to beneficence, the nurse has an obligation to implement actions that will benefit clients. The correct answer is option B. Nurse are obligated to respect clients' privacy and confidentiality. Question number 285. Mrs. X informs the nurse that she has lost her job due to excessive absences related to her wound. Two correct answers. The nurse should. Option A. Encourage the patient to express her feelings about the job loss. Option B. Contact social services to assist the patient with accessing available resources. Option C. Evaluate Mrs. X's understanding of her wound management. Option D. Explain to Mrs. X that she can no longer be seen at the clinic without a job. The correct answer are option A and B. Encourage the patient to express her feelings about the job loss. Contact social services to assist the patient with accessing available resources. Question number 286. Who will you inform first if there is a shortage in supplies in your shift? Option A. Nursing assistant. Option B. Purchasing personnel. Option C. Immediate nurse manager. Option D. Supplier. The correct answer is option C. Immediate nurse manager. Question number 287. A client requests you that he wants to go home against medical advice. What should you do? Option A. Inform the management. Option B. Inform the local police. Option C. Call the security guard. Option D. Allow the client to go home as he won't pose any threat to self or others. The correct answer option D. Allow the client to go home as he won't pose any threat to self or others. Question number 288. A patient in your care knocks their head on the bedside locker when reaching down to pick up something they have dropped. What do you do? Option A. Let the patient's relatives know so that they don't make a complaint and write an incident report for yourself so you remember the details in case there are problems in the future. Option B. Help the patient to a safe, comfortable position. Commence neurological observations and ask the patient's doctor to come and review them. Checking the injury isn't serious when this has taken place. Write up what happened and any future care in the nursing notes. Option C. Discuss the incident with the nurse in charge, and contact your union representative in case you get into trouble. Option D. Help the patient to a safe, comfortable position. Take a set of observations and report the incident to the nurse in charge who may call a doctor. Complete an incident form. At an appropriate time, discuss the incident with the patient and if they wish, their relatives. The correct answer is option D. Help the patient to a safe, comfortable position. Take a set of observations and report the incident to the nurse in charge, who may call a doctor. Complete an incident form. At an appropriate time, discuss the incident with the patient and, if they wish, their relatives. Question number 289. The nurse is in the hospital's public cafeteria and hears two nursing assistants talking about the patient in 406. They are using her name and discussing intimate details about her illness. Which of the following actions are best for the nurse to take? Option A. Go over and tell the nursing assistants that their actions are inappropriate, especially in a public place. Option B. Wait and tell the assistants later that they were overheard discussing the patient, otherwise they might be embarrassed. Option C. Tell the nursing assistant's supervisor about the incident. It is the supervisor's responsibility to address the issue. Option D. Say nothing. It is not the nurse's job. He or she is not responsible for the assistant's action. The correct answer, option A. Go over and tell the nursing assistants that their actions are inappropriate, especially in a public place. Question number 290. A diabetic multigravida is scheduled for an amniocentesis at 32 weeks gestation to determine the LS ratio and phosphatidylglycerol level. The LS ratio is 1 and the presence of phosphatidylglycerol is noted. The nurse's assessment of this data is: option A. The infant is at low risk for congenital anomalies. Option B. The infant is at high risk for intrauterine growth retardation. Option C. The infant is at high risk for respiratory distress syndrome. Option D. The infant is at high risk for birth trauma. The correct answer is option C. The infant is at high risk for respiratory distress syndrome. Question number 291. Clinical practice is based on evidence-based practice. Which of the following statements is true about this? Option A. Clinical practice based on clinical expertise and reasoning with the best knowledge available. Option B. Provision of computers at every nursing station to search for best evidence while providing care. Option C. Practice based on ritualistic way. Option D. Practice based on what nurse thinks is the best for patient. An adult has just returned to the unit from surgery. The nurse transferred him to his bed but did not put up the side rails. The correct answer is option A. Clinical practice based on clinical expertise and reasoning with the best knowledge available. Question number 292. What are the 4 stages of wound healing in the order they take place? Option A. Proliferative phase, inflammation phase, remodeling phase, maturation phase. Option B. Hemostasis, inflammation phase, proliferation phase, maturation phase. Option C. Inflammatory phase, dynamic stage, neutrophil phase, maturation phase. Option D. Hemostasis, proliferation phase, inflammation phase, remodeling phase. Support. The correct answer, option B. Hemostasis, inflammation phase, proliferation phase, maturation phase. Question number 293. What stage of pressure ulcer includes tissue involvement and crater formation? Choose 2 answers. Option A. Stage 1. Option B. Stage 2. Option C. Stage 3. Option D. Stage 4. The correct answer is option B. Stage 2 and option C. Stage 3. Question number 294. Appropriate wound dressing criteria includes all but 1. Option A. Allows gaseous exchange. Option B. Maintains optimum temperature and pH in the wound. Option C. Forms an effective barrier to. Option D. Allows removal of the dressing without pain or skin stripping. Option E. Is non-absorbent. The correct answer is option E. Is non-absorbent. Question number 295. If an elderly immobile patient had a grade 3 pressure sore, what would be your management? Option A, film dressing, mobilization, positioning, nutritional support. Option B, foam dressing, pressure relieving mattress, nutritional support. Option C, dry dressing, pressure relieving mattress, mobilization. Option D, hydrocolloid dressing, pressure relieving mattress, nutritional support. The correct answer is option B, foam dressing, pressure relieving mattress, nutritional support. Question number 296. Mrs. Smith developed an MRSA bacteremia from her abdominal wound and her son is blaming the staff. It has been highlighted during your ward clinical governance meeting because it has been reported as a serious incident, SI. SI is best described as Option A, any incident or occurrence that has the potential to cause harm and or has caused harm to a person or persons. Option B, consequence of an intervention, relating to a piece of equipment and or as a consequence of the working environment. Option C, incident requiring investigation that occurred in relation to NHS-funded services and care resulting in unexpected or avoidable death, permanent harm. Option D, all. The correct answer is option D, all. Question number 297. What are the steps for the proper urine collection? A, clean meters with soap and water. B, catch midstream. C, dispatch sample to laboratories immediately within 6 hours. D, ask the patient to void her remaining urine into the toilet or bedpan. Option A, B, and C. Option B, C, and D. Option A, B, and D. Option A, C, and D. The correct answer is option C, A, clean meters with soap and water. B, catch midstream, and D, ask the patient to void her remaining urine into the toilet or bedpan. Question number 298. A patient is prescribed metformin 1000 mg twice a day for his diabetes. While taking with the patient he states, I never eat breakfast, so I take 1/2 tablet at lunch and a whole tablet at supper because I don't want my blood sugar to drop. As his primary care nurse, you. Option A, tell him he has made a good decision and to continue. Option B, tell him to take a whole tablet with lunch and with supper. Option C, tell him to skip the morning dose and just take the dose at supper. Option D, tell him to take 1 tablet in the morning and 1 tablet in the evening as ordered. The correct answer is option D, tell him to take 1 tablet in the morning and 1 tablet in the evening as ordered. Question number 299. For an average person from UK who has non-insulin dependent diabetes, how many servings of fruits and vegetables per day should they take? Option A, 1 serving. Option B, 3 servings. Option C, 5 servings. Option D, 7 servings. The correct answer is option C, 5 servings. Question number 300. Alone, metformin does not cause hypoglycemia, low blood sugar. However, in rare cases, you may develop hypoglycemia if you combine metformin with Option A, a poor diet. Option B, strenuous exercise. Option C, excessive alcohol intake. Option D, other diabetes medications. Option E, all of the above.